Please welcome Sherry and her husband, Damien, to the show. I think your story is one that is so remarkable because it does talk about how far medicine has come. And let's go back, because I think that there's a lesson in your story for people who may be watching, because this all started, there's just maybe a little scab in your ear.
Yeah, I had a little scab in the middle of my ear. It just wasn't going away, and I didn't listen to my body to get it checked out, or just kept on thinking that it was going to heal on its own or something like that.
And it would bleed a little bit.
Yeah, it would
but
bleed.
It's just a scab that's just an area that's not getting better. And you put it off, but then you went to see a dermatologist.
Yeah, I went to the dermatologist with my mother, and we were there less than 5 minutes, and she's like, "Sherry, you have basal cell cancer." And I was like, "What?"
And people don't, what's crazy about your story is that you represent a lot of people out there, because people don't realize the ear is the third most common site for basal cell cancer.
And basal cell carcinoma, the most common form of skin cancer, but so unique to your case is that your basal cell was particularly invasive.
It's very aggressive.
Just much more aggressive than we typically see. And typically you do a small excision and that's the end of the story. So I know they did multiple excisions for you, but they kept finding that there's still more tumor. And then the point in time came where they actually told you that to get this out, we have to remove not only your external ear, but the middle ear and parts of the inner ear. I mean, I can't imagine getting that kind of news.
I just went numb. I mean, they were all sitting there with me, and I kind of more like tuned them out and didn't like really think about what they were saying. I just couldn't think that they were going to be taking a piece of me off. I mean, it just...
And Damien, you're watching your wife go through this. What was that like for you?
Very surreal. It took a lot of effort from the family to really keep her confidence high and lead her through this.
So when we looked at those pictures, I don't know if you all looked in the audience, but some of those pictures you had, the lower part of your ear was gone.
Essentially, that translates to having your whole ear missing, and that's what your reconstructive surgeon faced. I mean, this is a real difficult, about as tough as it gets, reconstruction, doing a complete ear. And the reconstruction is so fascinating, so many components to it. But I just want to go back and touch on that first part that people probably find really unbelievable, is this part where you had to go through tissue expansion. The first step, before they did anything else to try to create the framework of the ear, was creating this pocket in your arm sequentially, expanding your skin like so to stretch it out, to create a pocket that once it was stretched out, your doctor was then going to put in pieces of cartilage to reconstruct the ear, and we're going to get to that in just a second.
Would it be okay if I had you turn your head a little bit to the right? Because I want to show everyone at home. And Sherry's not done yet. There's still contouring that's going to be done, but I can tell you that from a distance, you would look, and it would take a double glance to realize that, wait a minute, is that her natural ear? And that is what, to me, is so remarkable, because when you look at it on the arm, it looks like science fiction.
Yeah.
Truly, Travis, a work of art. And if I may use Dr. Travis's ear, the key components are the helical rim is one key structure, and then what we call the antihelical rim, which is two pieces, the anterior and superior cruces, and this piece right here. Those are the key structures to that ear to give you a normal appearing ear, and you have that.
There's so much more to it. It started with the tissue expansion, of course, implantation of cartilage from Sherry's ribs, which now live in your ear. And there's just so much more to talk about. We're going to hear more of Sherry's incredible story after the break.